Hi, in our series Crystal Ball Gazing, we talk about future, and today we are going to gaze future of healthcare. COVID-19 was a pandemic which affected the entire humanity. It posed a big challenge to medical researchers, doctors, health workers, as the existing healthcare system and its infrastructure could not meet the requirement. The healthcare providers are now looking for creative ways to monitor the sick patients. Teleconsultation was a way emerged to reach patients. Wearable technology has also emerged in the recent time as a creative, safe, and innovative way to capture patient data. We would like to see how the healthcare will leap forward in the near future. The wearable devices might track temperature, blood oxygen level, many other health parameters besides pulse rate and blood pressure. The information could tell patients if they need to urgently see a doctor and let doctor know important information well before the patient reached to the hospital or clinic. So, in the coming years, hope we will able to intervene in the disease cycle before people get sick or interrupt in the immune response after they are afflicted. We will see technologies that can identify health risks and coming epidemics or bioterrorism by tracking, capturing, and identifying pathogens that previously could not be tracked. We will also see these same genetically engineered technologies diagnose infectious diseases in hours when it now takes days. In future, this class of diagnostic may be over the counter at your local drugstore, potentially allowing for reduced time to accurate diagnosis and treatment that may save your life. Additionally, if a patient is not responding to antibiotics, we may be able to extract the pathogens and other threats related to the patient's immune responses from their blood, restoring the blood closer to a healthy state. Few other predictions. Future belongs to precision medicines. Doctors will be able to look into our entire genome and pick out mutations that sit in specific genes in our cells. In other words, they will be able to see whether we are at risk of developing all sorts of diseases and prescribe behavior or medication that can help us fight off these diseases before they occur. Genetic testing and genomic profiling will be very crucial and important in the future time. On one hand, genetic testing typically looks for genetic traits and mutations. On the other hand, genomic profiling identifies mutation. For example, this might include cancer cells caused by an external factor such as smoke inhalation or sun exposure. In future, genetic testing and genomic profiling will be used and cross-referenced against wearable technologies data to provide custom treatment for patients. Telehealth will be used for initial primary care appointments. When a patient wearable device notices a change in health or if they feel under the weather, they will use their smartphone to schedule a telehealth appointment with their doctor. Gone will be the days of sitting in waiting rooms for hours for a basic diagnosis. The doctors will meet with patients over the phone and only meet in person with patients whenever it will be necessary. Another prediction, there will be increased access to health analytics. Patient information gathered from wearable technology, genetic and genomic testing, and interaction with providers will be gathered, de-identified, and used to inform future healthcare decisions. While clinical trials provide critical and important information about effectiveness and safety of prescription medication, they account for a very small percentage of people who will ultimately take a drug. With data collected from patients, the doctors, researchers would have a large number of real-world examples showcasing how medications work with different concerns such as morbidities or allergies. Additionally, this data could be used to inform how local and state governments inform citizens on healthcare issues and help healthcare providers build interdisciplinary teams to support the health of the entire community. Another important point, improved health outcomes with greater access to information. Henceforth, the researchers and doctors can customize care to reduce readmissions, build public health registries, and cut the cost of health care. These advancements will reduce efforts for clinical and administrative staff, support more accurate diseases tracking and prevention, and ensure patients are receiving the best possible care. Data sharing is at the center of this picture. Over the next decade, data sharing and technology have the power to transform how we deliver care. The fundamental tenets of the healthcare delivery will still apply, but the adoption of technology will free up time and resources to help providers truly achieve patient-centered care. Another important point, decentralization of healthcare. Continuing to build massive general hospitals is not always efficient for patient care, experience, or safety. We need to rethink traditional health care models and create alternate settings for delivering high quality, safe, and personalized care. That will be the real future of healthcare. Thank you, friends, for watching this series. Do make your comments in comment box.